We begin tonight with the remarkable disparity that exists in this country, both racially and economically. Earlier this week, the governor of Pennsylvania called for more testing for minority and vulnerable populations. While major health institutions have not yet succeeded in doing that, one woman in Philadelphia is taking on the task and taking the tests to the streets. It's fitting that you can find Dr. Ayla Stanford at church. No, she's not a pastor, though some have called her a saint. And many here in Philadelphia will tell you she's doing God's work.
Hallelujah, that God made a way.
Gwen Carter is about to be tested for COVID-19.
I'm deeply grateful, whatever the outcome of this test may be. Wouldn't know it if you wasn't here to do it.
So far, Dr. Stanford has tested more than 1,500 people in the city of brotherly love and counting.
How was it? Beautiful. Oh, okay, I'll take it.
No referrals, no car, no money, no problem. Here in her hometown of Philadelphia, blacks make up the majority of the population and nearly half of the coronavirus cases.
So many of us are face-front employees at the grocery stores and the post office and driving the buses and cleaning the hospital or working in the hospital. So we don't have an option to work from home.
While many are talking about how COVID-19 disproportionately sickens and kills those in black and brown communities, Dr. Stanford is taking action.
I just couldn't be part of another town hall meeting or watch another webinar or talk about how pervasive the social determinants of health are and not do anything.
So she rented a van. As a pediatric surgeon in private practice, she already had access to some tests and PPE.
I had some gowns and masks and gloves and things like that. Then I reached out to two doctors who I know and trust implicitly and asked if they would come along. They said yes. And then we had some medical students from Philadelphia College of Osteopathic Medicine that wanted to join up, and we got our team together. So it took literally 48 hours to get it together.
Her husband got in the driver's seat, and they hit the streets.
So you went old school. You started making house calls.
Yeah, absolutely. We went to the people.
And just like that, the Black Doctors COVID-19 Consortium was born, a group of medical professionals who assemble in church parking lots with protective gear and highly coveted coronavirus tests.
We basically set up like a triage unit, if you will. Every time we go, we pack up everything. It comes out of the van. We put everything up. We have a registration site and supplies table and accessioning to make sure all of our specimens are perfect.
This is the scene everywhere they go.
People are showing up, hundreds of cars waiting before you even open.
Absolutely. They are. I mean, the need is great. It just confirms for us that we're exactly where we need to be testing these communities.
This is day 4 of running the operation. We've got 200 people on the parking lot even before we open.
People who otherwise may not have access to a test.
It is the result of decades or even centuries of the way we are treating poor people and the way we are treating minorities.
Philadelphia, the birthplace of America and home of the Liberty Bell. But for all of its fanfare, it's also the poorest big city in the country, and the racial and economic disparities are evident.
What we found in Philadelphia is that there were areas where the number of tests that were being conducted per 1,000 people was about 5 or 4 times higher than in the poorer areas.
Dr. Usama Bilal, an epidemiologist at Drexel University, tracked who's getting tested here by zip code. He found residents in Philadelphia's wealthiest zip code, Center City, were 5 times more likely to get tested than those in North Philadelphia, home to some of the city's poorest zip codes.
So while people in poorer zip codes are not getting tested as often, you found that they're testing positive more often when they do get tested. Is that right?
Exactly. So the proportion of those tests that was positive is higher in those poorer zip codes.
A trend, he says, is not unique to Philadelphia, but exists in data found from New York to Barcelona. The number of positives tends to be higher in poorer areas.
I call it the epidemic that never ends. Like one day we will get out of coronavirus. I'm sure we will get out of it, we'll mitigate it, we'll do something, we'll get with a vaccine, etc. The epidemic that we really need to control long term is social inequality. And that, has centuries of history it has many different intersecting axes. So there is racism, there is classism, there is gender discrimination. There are many things going on there. And those things, when they intersect, they really cause disease.
And now the Red Cross is flagging a new concern. Prior to this pandemic, they say blood donations from African Americans were already low, accounting for just 4% of overall donations. But now the Red Cross tells ABC News they're facing a dire shortage of donations from black donors, which have dropped by 50%, now accounting for just 2% of all donations.
It's not uncommon for children and adults with sickle cell disease to need monthly blood transfusions to prevent strokes and acute chest, which is a pneumonia-like illness. It is very important that they receive blood that is very like their own.
Among those diagnosed with sickle cell disease, 98% are black.
African American donors can be unique heroes to individuals with sickle cell disease because they have proteins on their red cell. They're very much like the proteins that sit on the red cells of my patients. So it's very important that they donate blood.
At Children's Hospital of Philadelphia, one of the country's largest comprehensive sickle cell centers, they're donating thousands of masks and hand sanitizers to the families of young people with the disease.
And because individuals with sickle cell disease have to come to the hospital at times to get blood transfusions or to get blood tests or for sick visits, we want to make sure that they can get to the hospital as safely as possible. So we put these care packages together with fabric face coverings for a parent and a child and hand sanitizer so that they could get to the hospital safely.
Meanwhile, Dr. Stanford is hoping her work out in the community will prevent some from having to make a trip to the hospital by early detection and limiting the spread.
We are getting our results back already, and there are a lot of positives.
Just last week, Dr. Stanford and her team tested more than 360 people here at this megachurch.
We're here at Untitled Church, a great need in the community for testing for COVID-19. It has been one of access, availability, and education. And we're trying to provide all three here today.
It was like great adventure. There were so many cars, and we knew we only had 350 plus kits, so we had to turn people away.
Enon is the largest church in Philadelphia with roughly 12,000 members, helmed by Pastor Alan Waller.
Even before we hit the peak of the coronavirus, I know we're going to make it.
For weeks now, Pastor Waller's been streaming from an empty sanctuary, and he says he hasn't had any symptoms of COVID-19.
I'm just one of the people.
In fact, his rationale for getting tested was simply to encourage members of this underserved community to also get tested.
So I was just doing it not expecting to be positive, but expecting to just show people that it really doesn't hurt when it goes up your nose. And so the last thing I expected to get last week was a positive result.
A result he wasn't expecting from a test he likely wouldn't have taken were it not for Dr. Ayla Stanford.
I think I'm on assignment because I don't feel bad and I can speak up for people that may not feel good enough to speak up. We need testing. We need a lot of testing because had I not taken that test, I would have been one walking around, shedding, and potentially infecting someone who would have a worse experience with this same virus.
Undeterred, he's still preaching, now from home.
Sometimes God calls time out. Sometimes God will tell all of us, listen, it's time to sit down. We know that when America catches a cold, the Black community has pneumonia. And so we have to take extra steps to make sure that the message gets out. It's a twofold message. It's a challenge to the system to recognize the disparities that exist already. It's a challenge to our community to recognize that this is real, and we have to take responsibility for our own health.
Taking responsibility for the health and well-being in this community is exactly what Dr. Stanford is doing.
For my doctors and friends in other cities, you can do this. You can do this. And hopefully you have the support of your local and state government. But if you don't, you can do it.
Why are you angry?
I'm angry because maybe a week, I think a week is enough time for a government, with doctors and nurses and epidemiologists and MPH people and folks with money could put something together like this. The most vulnerable are, in this sense, are elderly, but African Americans are also vulnerable. And I don't see the resources, I don't even see the action or the movement into getting people tested.
Until then, it's Dr. Stanford to the rescue. With a quick tilt of their head and 5-second swab of the nose.
Now I'm going to turn it 5 times. Relax and breathe.
All further proof that superheroes really don't need capes.
Perfect.
This masked woman is saving lives just the same.
I think it's the most marvelous, wonderful thing that God laid on your heart to do.
Dr. Stanford, a blessing for so many. And a reminder from the Red Cross tonight that the need is great, and African Americans, as well as people of all races, are being urged to donate blood.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.